Hello, everyone. Thanks for joining us. Sorry, we're starting a couple of minutes late here. This is our first webinar that is fully remote, as we're a fully remote office, as I'm sure many of you are at this time. So thanks for joining us today and welcome. My name is Johanna Henderson. I'm the communications manager here at BC Healthy Communities, and I am joining you here from my home office in Victoria in the southwest corner of the province, which is on the unceded territories of the Songhees, Esquimalt, and Wasanic nations. And here at BCHC, that territorial acknowledgement is really important to us because it's a prompt for us to reflect a bit about the nature of our work and the colonial roots of the fields we work in, which include planning and public health, and even my own work in communications. So I use those acknowledgements as a way to think about how colonialism is embedded in my work and how I can challenge myself all the time to try to decolonize as I learn from feedback and my own research, and most importantly, the practices of others. So I'm seeing that folks are continuing to join, so we'll take a little time and allow for folks to get on the webinar and wait for them to settle in. First off, I should welcome you to our webinar, Creating Age-Friendly Communities, Approaches for Optimizing Your Needs Assessment and Planning Process. And yeah, now that I've given that territorial acknowledgement at the top, I'd love it if some of you could practice using Zoom and use the chat function here to say hello and let us know what territory you're joining us from, if you know, or the town that you're in if you're not familiar with your territory. So for those of you totally new to Zoom, if you just hover over the bottom of your screen, you'll see a menu bar with a chat option. It looks like a little talk bubble kind of in the center. If you click on that, it'll open a chat box and you can type into it. So I'm just going to open it now and see. Oh, hi, Carrie. Oh, nice to hear from a friendly, this is one of our partners in Interior Health. Oh, we've got folks from Courtney, from South Surrey, yeah, Comox, First Nation, unceded traditional territory. Awesome. Revelstoke. Hello, Danielle, Esquimalt and Songhees Nations as well. White Rock. Hi, Nancy. Fantastic, folks. It's really encouraging to see how many folks are familiar with the territory that they're on. So while you're in the chat box saying hello to everybody, let's do a little bit more housekeeping. So a couple more things about Zoom. You will see that menu with the chat box, which many of you are using, which is excellent. And then during this webinar, we will have Claire Sauvage-Mar, our Grants and Engagement Coordinator, in the chat. You may have seen her comment right at the top. So she will be chiming in with links and resources, but if you have specific questions for our panelist, kind of in the left-hand side of this menu where the chat is, there's also an icon that says Q&A, and it has two chat bubbles, and that's where you should enter your questions, and then we will take those questions at the end. I just think it's great to know that that's there now, so that if you have a question in the moment, you can definitely pop it into that box right away so that you don't forget it. And there's also an option there to ask questions anonymously. If you can't quite figure out how to use the Q&A, you can also pop your question into the chat and Claire will take it and move it into the Q&A for you. And then outside of this webinar platform, if you'd like to follow along on social media, or if you'd like to tweet about the chat we're having today, you can use the hashtag age-friendly planning. We will be live tweeting some of the highlights of this webinar as we go along. So you can also refer to the hashtag later as a bit of an archive of some of the top learnings of this webinar. And just a reminder, today's session is being recorded, so it'll be up on our YouTube channel just a few hours after we finish up here. So if you can think of anyone on your team, a colleague, maybe from another community who's not here today, but who you think might like to see this webinar, we'll be sending a follow-up email later today with a link to that recording so you can pass it on. Let's spend just a couple of minutes talking about BCHC and the Age-Friendly Capacity Building Program. So for those of you who aren't familiar with BCHC, we're a province-wide nonprofit that facilitates the ongoing development of healthy and equitable communities. And we believe that it's possible, but not just possible, it's necessary to create communities where it's easy for people to be healthy and well. And we also believe that by making those choices with community members' health and well-being in mind, we can move toward economic, environmental, and social sustainability. And that's why we're all here. That's why we do this work. We're a team of planners, public health and evaluation specialists, community engagement practitioners, and researchers. And we're operating kind of at that intersection between planning and public health. And I'm sure there are folks here who are joining us who have different parts of those lenses as well, which is really exciting. We also do things like distribute grant funding. We provide resources to communities and program funded supports. And we often work directly with and for communities, either through partnerships or fee-for-service relationships. So that's a little bit about BCHC and a little bit about the Age-Friendly Capacity Building Program. So this webinar itself is part of our Age-Friendly Capacity Building Program. And this is the program through which we support local government engagements and partnerships across sectors to create those age-friendly communities. It is a partnership with health authorities, the Ministry of Health, and the Union of BC Municipalities. And some of you might have got an email this morning introducing our Age-Friendly Action Guide. This is one of the reasons we wanted to have this webinar, is to introduce this Age-Friendly Action Guide. There's a lot of useful information in here for helping communities working towards becoming age-friendly in regards to planning programs, developing partnerships and collaboration. And there's a lot of great examples from leading communities across BC for what they've done in the age-friendly space. And there's also kind of a neat checklist there that we developed. So the URL is up there, bchealthycommunities.ca/age-friendly-guide. That's where you would go to download the guides. So definitely check it out later. Now, let's get into our agenda for today, the meat of the thing. We're gonna start with an introduction to age-friendly communities, just to make sure we all have the same kind of broad knowledge. And then Emily Johnson, our Healthy Community Planner, is going to do some exploring what equity is like and what an equity lens would be like for age-friendly planning, and just some thoughts around that. Our community well-being specialist, Sarah Dyer, is then going to do a little bit of information about meaningful engagement in the age-friendly process, and then we will finish it up with some thoughts around evaluation for the age-friendly process, and that will be done by our research and evaluation specialist, Connie Barrios. So now I'd like to hand it over to Sarah for an introduction to age-friendly communities. And I realize actually for many of you, this might be an introduction to Sarah as well. So Sarah joined us at BCHC last fall. And as I said, she's our community well-being specialist, and she oversees our age-friendly capacity building program. And even in the last few months that Sarah has been with us, I've learned so much from her. So I'm really excited that we get to share her with you folks on the call today. So with that, I will pass it over to Sarah. Thanks, everyone.
Hi, everyone. Thanks so much, Johanna, for such a lovely introduction. I'm so glad to have you all here today and excited to connect. If I can advance my slide, there we go. Before we start, or before I start, we are going to do just a quick poll, and I am learning how to do this as I go. So I'm going to relaunch. Okay. Hopefully you can see that. So we're just wanting to get a sense of where people are in this, and some people may not have started but are thinking about it. Some people are, have started or about to start their assessment or project. So it's just nice to have a picture of that moving forward here. And while I'm giving you a chance to do that, I wanted to, Johanna mentioned the email that she sent out with the the age-friendly action guide and the link. It's also posted on the website, obviously, and you can find it that way as well. So just hoping that you got that email. If anyone somehow didn't, let us know and we'll make sure to get it to you. But we'll also be giving you that link again today as well. And great, so it looks like people are, the greatest proportion of people are in the planning stages for an assessment. Some people are thinking about it, and some have started their assessment and project. Great, thank you so much everyone for filling that out, completing that, and just getting it off my screen. Okay, so I will be talking about introducing, sorry, there's my notes, introducing age-friendly communities to you, and starting with what is an age-friendly community. And these are communities that promote accessible and inclusive physical and social environments, programs, policies, and services that allow older adults with diverse needs to fully participate in their community and to actively age in place. Also, age-friendly communities importantly support and benefit people of all ages. Now, in order to truly make communities more age-friendly, local governments can take concrete steps, and they can do this in many sectors through partnerships and multi-sectoral collaboration. They can adjust and expand policies, programs, and services, and do this using the World Health Organization's approach across the 8 domains of age-friendly communities. In terms of the 8 domains, they are, sorry about that, they are in 3 environments. So we've got the physical built environment, the social environment, and the personal well-being environment. So in the first one, which is the physical environment, this contains the 3 domains of outdoor spaces and public buildings, public transportation, and housing. The social environment contains opportunities for social participation, respect and inclusion, and opportunities for employment and volunteerism. The third environment, the personal well-being environment, contains the domains of age-friendly communication and information, and community support and health services. So how do we become an age-friendly community? There, as many of you might know, there are 4 key steps to doing this. The first is to establish an age-friendly advisory committee. This would be multi-sectoral, of course, including older adults and a generally inclusive and diverse group of people. The second step is to pass a local council or district board resolution. This shows your commitment to promoting and supporting age-friendly in your community. The third step is to conduct an age-friendly assessment, and the fourth, to develop an age-friendly action plan based on that assessment. And these last 2 steps are part of Stream 1 UBCM Age-Friendly grant. And the Stream 2 is focused more on the project implementation after you've developed your action plan. So that's Stream 2. Today, we're really focusing more on the Stream 1, the needs assessment and action plan. In any case, with regards to becoming an age-friendly community, if you are looking for more information, you can always go over to the Province of BC's Age-Friendly webpage on how to become, they have a specific link on how to become an age-friendly community. And there's also an email there for coordinator, their coordinator, if you have any further questions. And let's see, so that's a bit of a synopsis of age-friendly communities for you today. And I just want to move on to what we're really going to be talking about, and that is how to optimize your age-friendly planning. And that would be through applying an equity lens, doing meaningful engagement, and evaluation. So with that, I will hand it over to our Healthy Community Planner, Emily Johnson, who's going to be covering applying an equity lens in age-friendly. Oh my goodness, I was off the slide, sorry.
Thanks, Sarah. So when we're talking about equity, I'm just going to do a high-level overview of what equity is. I know it is something that's talked about a lot, but for some people it's still a bit new. So equity is the fair distribution of power, opportunities, and resources to meet the needs of all people. And it's most simply understood in comparison to equality. So where equality is giving everyone the same resources or the same bike as in this image, regardless of individual circumstances, equity is distributing resources based on individual and community needs. So there are a number of different graphics that have been used to illustrate this concept. So if we consider the bike image, it's obvious how things like age, gender, and mobility might affect what kind of bike someone needs. But what's missing from this image and many others are the external factors and barriers that people face. So in this next example with the fence, we can think of the fence as these external factors and barriers beyond the individual, and the different boxes or ramps as the equitable distribution of resources and opportunities to overcome those barriers. The external factors beyond an individual's control are often termed the social determinants of health. And as you may already know, lifestyle choices actually determine a surprisingly small part of our health outcomes. So the social determinants of health are the environmental, social, cultural, and economic conditions of daily life that are beyond an individual's control, that strongly influence our mental, physical, spiritual, and social health and well-being. So these are things like housing, transportation, access to education and employment opportunities, access to healthcare, or access to open and green space, just as a couple of examples, and there's more on your screen there. And so these are areas that local governments can influence through the age-friendly policy and planning process, as well as program and service delivery. And applying an equity lens in age-friendly planning means first identifying differences in needs, resources, power, and opportunity, and then changing the way that we facilitate engagement processes, the way that we deliver program and services, and the way that we develop age-friendly communities to actively reduce those differences. So why is an equity lens important in age-friendly planning? Age is just one dimension on which inequities exist, and we know that the challenges of aging intersect with and amplify vulnerabilities related to factors such as gender, mobility, ability, ethnicity, culture, race, language, literacy, income, education, sexuality, and citizenship status. And often these different barriers intersect, and people basically just come together to create the different experiences of people in our communities. And so community initiatives designed to support older adults must use an equity lens to consider the disparities in lived experience that exist among people who are aging and the diverse communities that fall under the umbrella term of seniors or older adults. As with age-friendly communities, equity benefits everyone. An age-friendly community and an equitable community is one where people from all walks of life have the right to and can participate fully in social, economic, political, and cultural life. So in the beginning stages of age-friendly planning, an equity lens is important in identifying those key stakeholders for engagement, and an equity and inclusion lens that considers the social inequalities within the older adult group, such as income disparities, racism, albinism, homophobia, ageism, etc., can help local governments better respond to the needs of all people in the community. And addressing these social inequities and ensuring the inclusion of all in the beginning stages of your needs assessment is also cost effective at a time of shrinking city budgets. Including all voices and experiences up front supports the development of more responsive and sustainable age-friendly programs and policies. So an important concept to consider when reaching out to older adults is that there is no single definition for older adult. And a strict definition can actually be stigmatizing and might not reflect the reality of what being an older adult means. This follows the World Health Organization's age-friendly approach by defining older adulthood as a general life stage rather than a specifically delineated age group. And a recent policy brief on COVID-19 and older persons that was recently released by the United Nations states that the older population is an incredibly diverse group with chronological age only loosely correlated to biological age. So it's important to keep in mind that older adults are as a diverse group as any other group in the lifespan, and they experience older years differently from each other and have specific needs depending on diverse backgrounds. So there is a lot that we could talk about around equity, and this has just been a very quick overview. And over the years, BC Healthy Communities has learned a lot, and we're still continuing to move forward on that learning curve. But from an equity perspective, that's really the point. We need to know the limits of our own understanding and perspectives and aim to lift up the voices of others. And so with that, I'll pass it to Sarah to talk more about equitable engagement processes in your age-friendly planning. Thanks.
Thank you, Emily. I'm going to try and get the slides right this time. And okay, so I'll be talking about meaningful engagement. And I wanted to start with, what is engagement? So the IAP2, which is the International Association of Public Participation, view public participation, which is community engagement, as any process that involves the public in problem solving, decision making, and uses public input to make sustainable decisions. So the meaningful portion comes in through applying an equity lens throughout the process, allowing participation of diverse and vulnerable groups to inform decision making, and in a way that is relevant to the needs of everyone in the community. So this figure here depicts the 5 levels of public participation. And that starts with inform on the left, moving through consult, involve, collaborate, and empower on the far right. Of course, it's not always possible to operate at the full level of empowerment, but it's totally fine. What is important is to be completely transparent right from the beginning about how the input you're receiving from the engagement is going to affect decision-making or not, and what the follow-up will be with your engagement people, the people that you're engaging. So this process builds trust throughout your engagement. And so I want to next talk a little bit about equity in age-friendly engagement. So 4 kind of key points or tips that I have today are, first, to consider the notion of context experts. So these are people who have deep knowledge of an area due to having lived experience. And what if we treat these individuals in the same manner that we would treat content experts? So this would be bringing context experts into the planning of your engagement early on and compensating them as you would content experts. And in this vein, the second point is to start by also identifying who are the most vulnerable groups in your community, and then create a process that focuses on this group in terms of your outreach and engagement. And this ensures that they're included, what works for reaching out and engaging them will work for the broader community, and it ensures that the more vulnerable groups are included in engagement and not missed. Now, one way to help you identify these groups could be to connect with community organizations that work with vulnerable groups. You can partner with them, and they can help identify communities that are in need of support, and also perhaps provide insight on how you might even be able to reach them, the vulnerable communities. And so organization examples could be universities, voluntary groups, municipal first responders, charities, for example. So this point really highlights the importance for multi-sectoral collaboration, because it allows the broadest reach and depth when you're connecting with vulnerable communities. The next point is while you're moving through the process, keeping an eye on or taking stock periodically through what are the groups that have been engaged and what are the groups that haven't and why. And then what this allows you to do is, in the middle of the process somewhere, you're able to adjust the tactics you're using for outreach and engagement to meet maybe the missing groups where they are. And then it allows you to include their voices in the process and not be missed. So the 4th tip or point is removing barriers to participation. So this would be through compensating people for participating for things like childcare, transportation, wage replacement, and this enables people who might be facing socioeconomic challenges to be able to take part, and then this works towards correcting any possible overrepresentation of advantaged groups in the engagement. Okay, so the question on everyone's minds really is, how do we reach out to and engage older adults and other vulnerable groups during COVID-19 and physical distancing? And of course, as we know, COVID-19 has been putting unprecedented pressure or strain on our communities to move everything online with physical distancing. We also know that the most vulnerable groups are the most disproportionately affected by the digital divide. So while we know a lot of older adults are digitally connected, but we also know a lot are not. So how do we reach those that are hard to reach, who are not digitally connected and who are possibly isolated and alone? One thing is we can go back to old school and could consider using radio. You could put an ad for your engagement on the radio. And a lot of older adults, it's still a commonly used thing, and maybe not older adults, but also the regular mail, you could put an ad in with the utility bills that go out, or simply mail them on their own. Could call people on their landlines, put posters up at entrances to grocery stores and pharmacies, and now that other businesses are opening up, appropriate ones there as well. You could consider door knocking. This is one way to really get at maybe people who might be alone. Younger people who might need a summer job could be interested in doing this, and this would actually have the double benefit of encouraging intergenerational connections. You could also consider reaching out to caregivers of older adults, and they can inform them about the issue and see if they would like to participate. And if so, they can also help them navigate any digital engagement surveys or otherwise, or they can actually just get them to where the engagement is happening. Which brings me to an idea that's come up, which is to have a table in the park and can interview people there at a safe distance outside. And you can simply enter their responses into your laptop or just on paper, whatever works. So that's kind of a nice one. And one other thing actually is you could always connect with people that you already know and have connections with who might be in a vulnerable group, or even who they might know, and speak to those individuals who are in vulnerable groups that you're able to connect with personally, and just see what they think might be effective ways to get people involved and discuss barriers that they may face. So that's another helpful way to figure out some outreach methods. So the bottom line here is obviously there's no one size fits all. And it's basically you're probably going to take parts of different approaches and create your own hybrids that work in your own community. And essentially it's going to look different in different communities. So that's the meaningful engagement in a nutshell that I wanted to talk about today. And at this point, that brings us to the evaluation section of the webinar. And so I'm going to hand it over to our research and evaluation specialist, Connie Barrios. And
thanks, Sarah. Hi, everyone. So before we get started, I'm just going to run a quick poll regarding where you're at with your evaluation plan for your age-friendly community work. So some of the options are, you have your evaluation plan already and you're set to go. You've been thinking about your evaluation plan for this work, or you haven't started to consider your evaluation plan for this work. So take a look, and you can just reply and hit submit. So as you're doing that, this is just a quick friendly reminder that after the webinar itself, we will be distributing a quick survey. It shouldn't take more than 5 minutes or so, and that's just to get your feedback on what you thought about today's webinar. We really just want to hear from you. We want to know how we can improve, and then also this will inform how we can best support you with this type of work as we move forward into the year. So yeah, really appreciate your feedback there. So if you could just take a couple minutes to fill that out, that'd be great. All right. So I'll just wrap up that poll there. I'm not getting the poll responses on my screen here.
this is Sarah. Can you hear me? I have it on mine.
Okay.
Do you want me to let you know?
Go through it? Yeah.
Sure. I'll leave my camera off. There, we have about 16% who already have an evaluation plan. 42% who've been thinking about how to evaluate this work, and the same percent who haven't considered it yet, 42%.
Okay.
So
Awesome. So that sounds good. So, before you get too far down that plan, maybe it's good that we're reviewing this. So what is evaluation? Oh, now I'm seeing it. Okay.
sorry.
That's okay. So what does evaluation really look like in the context of Stream 1? Well, you might be pleased to know that it's really just conducting that needs assessment. So conducting a needs assessment serves a number of purposes for taking action towards advancing your age-friendly community goals. First, it really paints a picture of where things are at now with respect to being an age-friendly community. You really, before you know where you're going, you need to know where you're at. So it really supports with that. It identifies the strengths and the assets in your community, as well as any gaps that may exist, and informs how to really improve and fill in those gaps. So I really want to emphasize the importance of being aware of the strengths and the assets that are existing in your community, as they're invaluable in helping you to achieve your goals. And sometimes they can be overlooked because we tend to focus more on the gaps. So examples of community assets include the skills and the times of the community members, existing service infrastructure that exists in your community. So that's some of the non-for-profit organizations in your community or other organizations, and the community physical spaces like parks and community centers. These are all assets that you can leverage to move your project forward, or to move your needs assessment forward, I should say. So a needs assessment also helps to establish a baseline level of information so that you can look back and see how things have changed over time as a result of the age-friendly policy or practice that you've introduced or implemented. So it really helps you to see change over time, which is that aspect of evaluation work. Ultimately, conducting a utility-focused needs assessment will inform and develop your action plan towards the future. Okay, so when conducting a needs assessment, you can look across the 8 age-friendly domains that Sarah mentioned earlier. In addition to looking at the physical environment, this can also include things like reviewing municipal programs, services, and amenities that are currently offered to older adults in your community. You don't need to reinvent the wheel when you're doing this work, when you're doing that needs assessment. There are plenty of resources out there to support you with this work. One of them is the Public Health Agency of Canada's Guide to Evaluation on Age-Friendly Communities. Another is the WHO. They have a checklist of the 8 domains that you can use. We'll be sending out links to these resources following the webinar. Okay, so when conducting a needs assessment, it's important to conduct an equitable needs assessment. I know that we're really reinforcing that on this webinar because of its importance. So an equitable needs assessment really means gathering those diverse perspectives from often harder to reach groups. So why is this important? Well, diverse perspectives will help you to create policies that best anticipate and respond to community needs. Policies that are informed by diverse perspectives, especially those that are harder to reach perspectives, will be more sound because they're evidence informed. And they also tend to be more resilient over time because people really support them and buy into them. Okay, so one way to increase diversity in the planning phase of your needs assessment is to hire community members themselves as the needs assessment organizers or coordinators, and to collaborate with other agencies in your region to conduct the needs assessment. You also want to gather different forms of information. So while both quantitative data, so those are the numbers, and qualitative data, so stories, they're both important. Qualitative data, though, that is what elicits more in-depth information, and it's what provides context. In-depth information is important because it allows you to better understand the different groups in your community and how they're disproportionately affected by certain decisions or policies, and allows you to see the disparities that likely exist in the community. So that moves us to the age-friendly action plan, which you'll all ultimately be working towards. So the completion of an equitable needs assessment will result in an action plan that includes recommendations that are responsive and best address community needs. This will help guide future age-friendly policy and programming. The action plan should have a clear overarching goal that it's going to achieve and the specific activities that are going to be carried out to achieve that goal. Activities outlined should also have clear objectives that align with that broader overarching goal. Activity objectives should be specific, measurable, actionable, realistic, and timely, often referred to as SMART objectives. So SMART objectives, so that when you're presenting your action plan to council can clearly see your plan to help you, that you're going to follow to achieve your ultimate goal. So for example, during initial conversations with older adults in your community, they tell you that they don't really take any walks down Main Street because there are no places for them to rest. The needs assessment then confirms this, as town records show that there are only 2 benches on a 4-kilometer stretch on Main Street. So the objective of one of your activities within your action plan could be to make Main Street walkable by installing 3 benches per kilometer by next April. So that would be a SMART objective. Okay, so once you've had an opportunity to share your action plan with council and they have passed it and approved it, you can use that action plan as a way to share this knowledge, as a knowledge translation tool essentially, to share the knowledge with the broader community at large. So that includes, you know, those that haven't been involved in the process to date. You really want to engage people as much as possible and sharing this knowledge with those with living and lived experience, as well as age-friendly project stakeholders. All right, well, that's it for me. Pass it back to you, Sarah.
Thank you. I was just looking for the bar to unmute myself. Mm-hmm. And okay, so we are next taking questions through the chat, not the chat, I guess, through the Q&A. I noticed on here I may need some help because the Q&A is just not opening for me. I can't see what the questions are. Claire is our person in there. I'm wondering if you're able to read them to me.
Definitely. So our first question is from Susan, asking, how do you gather needs assessment data about housing that is not available through Stats Canada, especially private housing such as square foot per PP and accessibility of current housing?
Okay, that is a very good question. And because I'm new here and I know that BCHC has done housing needs assessments, but I have not, they were before I joined. Not sure if anyone—
Sarah, I can take that one if you'd like.
Oh, that's great. I was gonna, thanks, Joe.
So this is actually, yeah, Carrie is also answering in the chat, which is exactly what I was going to say, is it's a great time to ask that question. And people are, obviously the province is interested because as of April 2019, housing needs assessments are mandated for all local governments in BC with very few exceptions. So if you're in the know about things that have been coming up, you may have seen that a lot of contracts have been coming out to complete these housing needs assessments. And as Carrie's saying, and I completely agree, if you see that your community is doing a housing needs assessment right now or is looking at doing one, you can be involved. You can definitely check with your local government if you're not part of your local government. But once that housing needs assessment is complete, that is where you would get that data, and it would give you information on private housing and square feet per person. That would be available as part of that, because there are certain points that a housing needs assessment needs to cover in order to be acceptable under those guidelines, those mandated guidelines that are provided by the province for those housing needs assessments. We actually did a webinar about these a few years back. So when we send out the link to this webinar later, you will be able to see our YouTube channel, and you'll be able to find that webinar as well, and you can watch it if you're interested. Yeah, and there's actually some great information happening in the chat box as well. Carrie's right. So they're updated every 5 years, these housing needs assessments. They will be quite up to date. So Susan, I'm not sure what community you're in, so I can't advise you as to whether your community's completed one, but that information is available. So I hope that answers your question.
Thanks so much, Joe. Joe knows all the history of our organization, which I'm still learning. Okay, so we have one more question in the chat or in the question answer box, which I can't see still.
I'll jump back in, Sarah. So this is a question from Patrick, and he'd love to hear what the panelists' thoughts are on the term age-friendly. And specifically, is it right to call age-friendly work equitable if the focus is on older adults with some side benefits for other age groups?
I can start on that, and if anyone else has some comments, they can, on the panel, I can chime in, or in the chat box. So age-friendly is based on equity, and it uses what's in the age span, what is the most vulnerable group, to do its put the focus on that for planning, etc. And yeah, then when you target the most vulnerable groups, what you do ends up benefiting everybody. So with age friendly, it is the lifespan, it is young, and especially focusing on really young and older. But my opinion is it is fair to call it equitable because it is following that principle of looking at vulnerable groups and going from there. Does anyone else have any thoughts?
Yeah, I think that's a really great question. And I think it goes back to how we define, oh, sorry, I'm not on video, how we define equity. And so the difference, again, the difference between equality and equity, and identifying those groups that have higher needs. And so we know that older age groups face greater social isolation, have more mobility needs. So the age-friendly planning, yes, it targets it does tend to focus on that older age group, and that's okay. Sometimes you have to focus your resources where they're needed, and this is one area, and there has to be other initiatives to support other communities who also need support. And so age-friendly does focus on this older age group, and I think that's okay because we're using this equity lens.
Thanks so much, Emily.
And we have one more of a comment in the Q&A from Nancy, who notes that that means that age-friendly could also mean people who are economically challenged regardless of chronological age. So again, more of a comment there. And if anyone has any last-minute questions to pop into that Q&A or into the chat, you're more than welcome to do that now.
Thanks, everyone. So are there more questions coming into the chat box or into the Q&A, Claire?
It looks like we don't have any more questions here in the Q&A.
Oh, okay. There's a comment in the chat box. Would be fabulous to be able to get a copy of the chat box because there's so many valuable resources here, but I just can't write fast enough. We will be compiling any of the links that came through here into our follow-up email. That's correct, Claire, right? We can,
yes.
Yeah, okay.
And we can also share the chat as well. So we'll make sure to download it, and none of that valuable information will be lost.
Yes. And okay, so if there's no more questions at the moment, I'd just really like to thank everybody for joining us today. I really hope that what we've talked about today has helped you with your age-friendly planning or thinking about your age-friendly planning, and that there you have a bit of a greater understanding about the three components that we were talking about: applying an equity lens, meaningful engagement, and evaluation in the terms of the needs assessment. We will be sending you, as we just mentioned, the links to the resources that were mentioned in the webinar, plus others, as well as the ones in the chat box, in a follow-up email. And also included in that will be the action guide, which is obviously on its own a great resource, lots of material in there, and including their own checklist, or our own checklist. So what was the other thing I wanted to let you know? Also in that email, we'll be asking you for, if you're interested in giving your consent, to share your email address with the rest of those who were on this webinar. We just thought it might be a great idea to connect everybody, and they can share learnings and success stories, perhaps sort of starting a community of interest. So that'll be in the email as well. And if you consent, then we'll share the list, or who has ever consented will share those emails, and so everyone can stay connected. Also, there will be, when you sign off this webinar, there will be, as Connie noted, an evaluation or survey pop up that you can do right away. It'll just take a few minutes and it'll be done and over with, and it will really, really help us to learn and improve with age-friendly webinars and webinars in general, I'm sure. I think that is everything. I don't think I've missed anything.
Sarah,
Thank you.
There's one late question that just popped in from
Oh,
Laverne.
sure.
Okay. Laverne writes, in our rural area, given that we need more young people to be able to keep aging residents in the area, we are tempted to call some of our activities all age friendly. Thoughts?
Nice. Oh, I think that's really great. I mean, and I know, hi Laverne, by the way. And I think that's really innovative and a really good idea. And I understand with rural communities, yeah, you want to keep the age diverse in your community, or increase that and attract people there. And being an age-friendly community attracts people as well, of all ages, because they know they can age, they can have family, grow old, and live there throughout their life and not have to move somewhere at a certain age.
That's also, I just chiming in, that's also a really great example of adapting this age-friendly needs assessment and the age-friendly planning process to your unique context. So like you said, in your rural context, that makes more sense to talk about all ages, because that's where you've identified a need. So just a good example of the flexibility.
Thanks again, Emily. Okay. Any further comments, questions? Yeah. And very important to adapt your community to your unique context, just being shared there. Okay, so I think that we are at the end, and I think that, one thing I didn't finish saying, I'm sorry, is that here's my email, which I think a lot of you have. But if you want to have further discussion or questions that you have that come up later, or anything at all, please feel free to contact me using this email address. And I really look forward to connecting with you on the age-friendly planning and assessments and so on. So everyone, have a great day, and thank you again for joining.